How does aspirin work? Your heart pumps blood to your entire body through a network of blood vessels known as the circulatory system. Your blood supplies the cells in your body with the oxygen and nutrients they need. If you have had a heart attack or stroke, or have angina, peripheral arterial disease, or coronary artery disease, your doctor may prescribe you aspirin. Aspirin reduces your risk of blood clots. A blood clot is made up of a fibrin, long strands of protein that form a net. Platelets and cells clump together and sticks to this net, forming a clot. Aspirin interrupts the clotting process by stopping an enzyme called COX1 from working. This interruption makes platelets and cells less sticky so they can't clump together and form a clot. The evidence showed that aspirin use of primary prevention of CVD was associated with a decreased risk of myocardial infarction and stroke. So whenever you think to stop or change any medication, even if you are worried about side effects, talk to your GP first, as changing or missing a dose could harm your health.